When we talk about health disparities, what's the biggest evidence that we have that they exist?
There are different statistics in the country, and these statistics are telling us that health disparities do exist. It's like a patient. If you want to know if a patient is alive, you have vital signs. So if we want to know if there are health disparities, there are going to be some numbers that will tell us that health disparities are affecting our society. And just to give you some examples, you're going to have specific racial or ethnic groups that are going to be afflicted with some chronic conditions like diabetes more than other groups. Same thing for hypertension, problems during pregnancy, low birth weight in babies, and so on.
Now, those instances that you mentioned could be genetic. They don't have to be because of the differences in healthcare, do they? So, Gloria, what would you say?
I agree with you. Some are genetic, but I think that what helps to exacerbate the problem is the fact that there are the disparities that exist in our society. When I think of one group that we're working with through the African American Health Advisory Committee with our senior population and some of the disparities that they're facing in terms of access, in terms of just knowing the resources that are available. So we started a support group for the adult children who are caring for their more senior parents. And that has been going on for 2 years now.
Gloria talked about access and knowledge of resources. Would you say it's up to the individual to find the access, to know the resources?
It is up to the individual, but there are some communities that don't have those resources. And, you know, a prime example is here in East Palo Alto. Many years ago, we didn't have access. Now we have access, which is Ravenswood Clinic and some county clinics now. But that doesn't mean that patients know about Ravenswood. So to answer your question, it is up to them, and they do come to us and reach in to the clinic, saying that they need our help. But I think that more towards prevention and not just when they need it is something more much more needed now in the community to prevent chronic conditions.
Okay,
And I
now,
think-
yes,
sorry.
go on.
I think also there are many of us who serve as advocates for those who need direction on how to access health care. And I just think that that's an important role in our community, let it be through a health center like Ravenswood, or through our health committee, or through just groups of community people who have an interest in wanting to help others through, for instance, the African Women's Development Fund that we'll talk about.
Yeah.
Sure.
I think in general, access is not just getting into a given facility, because you may have and I'm talking about in general in the country, you may have clinics, but if a patient is not covered under a specific, you know, insurance or medical coverage, you may have that facility that provides medical care, but if the person is not covered, that person is not going to have the access. That's in terms of coverage. Then you may have that you have the services, but probably the facility is not, you know, culturally and linguistically appropriate to the patient. So it could be that the facility doesn't understand the patient's culture, doesn't speak the patient's language, and that's a barrier.
So why is, you would think if somebody came to you with indication of diabetes, there's certain things a doctor would do. in terms of treatment. So why is knowledge of that person's culture so important? Wouldn't everybody be treated the same way if you had diabetes at a certain level?
Well, I'm not so sure of that, but I do think that one of the reasons why we encourage people to take someone with them to the doctor so that you can hear that interpretation from two directions. And I think oftentimes just the insensitivity of not knowing the culture can oftentimes be a barrier between the health provider and the patient.
What type of differences are we talking about? Will, you brought up the subject.
Right. Big differences. If you or if a medical provider understands the patient's culture and speaks the patient language, this person is going to be able to deliver his or her message in a better way. It's going to be more sensitive to what the patient is feeling, and the motivation component of the chronic care is going to be more accepted for the patient or by the patient.
Well, do you know you can be, I'm thinking not of a specific ethnic group, and still have problems interacting with your doctor?
Oh, absolutely.
So why the emphasis on understanding the culture when this could be a common concern in general that patients have with their doctors?
Absolutely. You think of, I think about our seniors and the fact that they look at the health professional in one light, and they might not question some of what the health professional is saying because they're so respected and looked
Where the
at in
doctor
high
is
esteem.
boss.
Exactly. Not all the time, but certainly I've heard enough cases.
Tiffany, you work with, I would think, Pacific Islanders.
Correct.
In terms of diabetes. What is there in terms of Pacific Islanders and their culture? Understanding their culture becomes important. Or is there anything?
I think part of it is culture and part of it is just health literacy in general. Them not understanding the different components of, just the anatomy maybe of their body, how things are connected, how a health advocate or health coach would explain those things to them in a culturally and a linguistic appropriate way. As opposed to the doctor who, like Gloria said, a lot of Pacific Islanders see the doctor as, okay, whatever they say, they'll just do it, But the health coach and the health advocate are more trained to discuss those things in depth with the patient so that they clearly understand.
Now, that brings up a question. If the doctor says do something, what's wrong with doing what the doctor says do?
Well, certainly you want to have trust in your health provider. But I think the main thing is to ask those questions. And I think oftentimes we don't ask enough questions in situations when we're interacting with our health provider.
And that is a good point, because when you are interacting with a patient, unfortunately some medical professionals, they just attack the patient with information. They want to be done with that patient within that 15-minute visit, and they are just like, okay, I need you to do this, I need you to take this medication, you're going to take it like that, and I want to see you in 3 or 6 months. Tiffany brought up something really important when it comes to health literacy. If the patient didn't understand what the doctor says, I don't think he or she is going to be in compliance with that. So that's why in Ravenswood right now, we are training our health coaches and the whole care team on this ask, tell, ask our patient. So we ask, we wait until the patient gives us the information. Then we have a period of time where we provide information to the patient, and then we ask to make sure that the patient and the medical provider and the health coach are on the same page.